Now, community members are protesting outside the Ntunjambili Hospital in Kranskop in the KwaZulu-Natal midlands. They're calling for the removal of COVID-19 patients from that facility. Now, police say that the protest began last night as they blockaded entrances to the hospital. Now, the Ntunjambili Hospital was identified as a quarantine facility for COVID-19 patients. That's according to government. For more, though, let's cross to Ayanda Mhlongo, who is, of course, in Kranskop as well. Ayanda, 759 COVID-19 cases, but it seems people are not happy with this facility being used as a quarantine site.
Yes, certainly, Arabile, the community of Ntunjambili and surrounding areas here saying to us that this is what forced them to break the lockdown regulations and blockade the streets. And basically, their main aim was to shut down this hospital. They are saying that they are fearful that the staff at the hospital are community members and that they are the ones that also are patients and require services from this hospital. And so they fear that if these patients are brought into the hospital, or more patients are brought into the hospital, this could then spread to the community. Arabile, we've been trying to get hold of the health department here in KwaZulu-Natal because the information that we've been receiving, of course, so far has just been coming from the community to get the health department to confirm how many patients are already in the hospital. From the community, we understand there are 4 and 10 more were expected to be brought into the hospital today. But as I said, this is just information that we've been getting from the community, and we have not yet got confirmation from the health department as to how many patients are now at the hospital. But what I can tell you, Arabile, that it's certainly been a busy day for police. I'm sure you've just seen a police vehicle passing by. There's been quite a heavy deployment of police in the area. It's a wide area that the police are trying to cover, and they certainly have had their hands full last night. In fact, as I speak to you, I can just see from a distance the police are now using tear gas and rubber bullets to try and disperse the crowds that are regrouping. It's a bit quiet now from where we are, but it's certainly been quite a busy day for the police. The community are saying that they are going to continue to protest. They do not want any patients now to be admitted into this hospital until they speak to, until they are addressed by the health department or leaders of the provincial government.
Ayanda, do those people who are protesting not actually know that the area was used initially as a quarantine site? It was actually aimed at fighting the COVID-19 pandemic. Were they perhaps not part of those discussions, or were they not? Did they not know that that actually is the case?
Well, Arabile, a very important question you're asking, and this is what we asked the community, and they're saying to us no. And they're saying to us that is why they have opted to protest, because they're saying that they've been trying to get hold of the management and the hospital board to speak to the community, or at least just to meet some of the community leaders who can then disperse that information to the community. They're saying that they've tried to meet with them to find out what role this hospital is playing, how many patients are going to come in. But more importantly, there has also been, we understand, concerns about the protective gear for the hospital staff. And so this is why the committee is saying that they're very much concerned that the staff themselves do not have the necessary protective gear. There are several challenges with the hospital. Apparently, the area also has water challenges. And as a result, they're saying they feel that it's not a hospital that is suitable for the COVID-19 patients to be admitted here. And there has not been any communication between the hospital management and the community.
So where to? Where do they believe these patients should be going? Where should these COVID-19 patients be transported to and be treated then?
Arabile, they're saying that these patients must go to the hospitals from the areas in which they come. You know, what we've picked up, Arabile, is also in terms of information, that there seems to not be a lot of information around the virus, how the virus spreads. And I did ask that, and I posed this question to the community on whether or not there has been any awareness campaign. And they were saying no. In fact, one of the leaders admitting and saying that the problem could not be as it is now. Had there been some awareness campaign from the health department, had they done gone door to doors and possibly handed out pamphlets or just spoken to the community members. It seems that there's a very lack of understanding and information around the virus in itself and how COVID-19 spreads. And for them, they simply believe that as soon as a patient enters this hospital, then everybody who's going to be inside is to be infected. And they're saying these patients must go to the hospitals in the areas where they come from.
Look, health officials certainly need to get involved very quickly and stem this one and really nip it in the bud as soon as possible and get more. Ayanda Mhlongo, appreciate that. Our reporter there out in Ntunjambili, of course, getting a sense of that quarantine site. It was aimed as quarantining COVID-19 patients, but unfortunately, that is not to be the case. Well, that is where we say goodbye to our SABC 3 viewers. Thank you so much for tuning in. We'll be back again, of course, on point, back tomorrow at 12 p.m. My colleague Nzinga Kunta starting that off then as well. Do continue to stay with us, though. If you are on SABC News, we continue to give you more news, especially international news regarding COVID-19, right after this.